One of the primary schools of thought in psychology, which informs a lot of therapeutic practices, is cognitive behavior therapy. CBT or cognitive behavior therapy is something that many of you may have heard about. And often you may wonder, what is this actually really about? It's important for you to know that cognitive behavior therapy or CBT was developed by Aaron Beck. And this was a treatment that he had designed specifically for working with individuals who may have a diagnosis of depression. Over the years, CBT has been expanded to include treatment paradigms for different clinical conditions, which include anxiety disorders, eating disorders, panic anxiety, a range of different conditions in which CBT has found a lot of effectiveness. Significant amount of research has been done over the years across cultures, which has shown that CBT as an approach can be extremely effective in helping individuals overcome different challenges. It's not just something that has been looked at when you're looking at interventions for clinical conditions. CBT, in fact, also is utilized for certain other issues as well, such as for individuals who may have low self-esteem, low self-confidence, looking at aspects like communication. A lot of these other elements are also considered when you're looking at CBT interventions. When you are talking about cognitive behavior therapy, it's important for you to understand that how an individual thinks and behaves often impacts the ways in which they're also feeling about situations. These three aspects are very intricately linked to each other. In a certain situation, you may have a particular thought process in which you may judge yourself to be feeling very inadequate. For instance, you find yourself in a scenario where you need to make a presentation, and the automatic thought that comes to your mind is that I can't do it. I am just not good enough to be able to perform in this situation. Where is this thought coming from? This thought may be coming from certain past experiences in which you saw that you had a difficulty in being able to perform in that situation. The next time you're finding yourself in that scenario, you tend to assume that this would be again the same play of events that would end up occurring. As a result of that, you tend to hesitate. You don't allow yourself to engage in that situation. You may just completely avoid it or find yourself withdrawing from being able to even consider that this could be something that you would like to try. So in CBT, one would be looking at working on some of these thought patterns which have gotten embedded in your mind. It is important to understand that some of these automatic thoughts become linked to larger belief systems, and the idea in cognitive behavior therapy is to start identifying what are these larger belief systems and how is it that you can start replacing these thoughts which come automatically into your mind, which are negative, which may prevent you from functioning across different situations, with thoughts which are going to allow you to function more effectively. This also ensures that it's not just that your response is changing in situations, but how you're also feeling towards those situations or feeling about your own self, that also undergoes a certain change. CBT is a comprehensive approach which involves not just working with the therapist within the session, but also often incorporates working outside on your own through certain assignments, through certain processes which you decide on with the therapist in conjunction with them, to find ways to be able to generalize what you are understanding in your therapeutic setting to the outside world in which you're actually living. Working through CBT can give you very good results, and it is one of the primary mechanisms through which treatments are done by a lot of therapists who practice cognitive behavior therapy.